Imagine waking up with a sudden, pounding headache, chills that make your teeth chatter, and a fever that refuses to break. A few days later, a mysterious rash starts to appear on your body. What could be causing these unsettling symptoms? Today, we're diving into a lesser-known but important infectious disease, Murine Typhus. Murine Typhus, also known as Endemic Typhus or rat flea typhus, is a disease that might sound unfamiliar to many, yet it has quietly affected people across the globe for centuries. Caused by the bacteria Rickettsia typhi and Rickettsia fleas, this illness is primarily spread through the bite of infected fleas, particularly those that live on rats, mice, and sometimes cats or opossums. While it's not as common as some other infectious diseases, its symptoms can be severe, and understanding how it works is key to staying safe and healthy. Let's break down everything you need to know about Murine typhus, from its warning signs to how it's diagnosed, treated, and most importantly, prevented. Symptoms of Murine typhus. The symptoms of Murine typhus don't appear immediately after infection. In fact, there's an incubation period of about 6 to 18 days after the bacteria enter the body. The illness often starts suddenly and can be mistaken for a variety of other common infections. Here's what to watch for. The first signs are typically shaking chills, a high fever, and a severe headache. The fever can be relentless, lasting around 12 days if untreated. Patients often feel overwhelmingly tired and may also experience muscle aches and general malaise. But what really sets Murine typhus apart is the rash that appears a few days after the onset of the other symptoms. This rash typically begins on the torso, showing up in just a few spots at first, before gradually spreading to the arms and legs. The rash can be faint and sometimes goes unnoticed, especially in adults. While most people recover fully with prompt treatment, Murine typhus can be more severe in older adults. In rare cases, complications can develop, and without treatment, the disease can even be fatal. Diagnosis of Murine typhus. Recognizing Murine typhus can be tricky, as its symptoms overlap with those of other illnesses, such as the flu or other types of typhus. Diagnosis starts with a thorough evaluation by a doctor who considers the patient's symptoms, recent travel history, and possible exposure to fleas or rodents. To confirm the diagnosis, doctors may perform several tests. One common method is a biopsy of the rash, where a small sample of skin is taken and examined using an immunofluorescence assay. This technique helps detect the presence of Rickettsia bacteria directly from the affected tissue. Another advanced tool is the polymerase chain reaction, or PCR, which can rapidly identify the bacteria's genetic material in the body. Blood tests are also used, particularly to detect antibodies produced in response to the infection. However, these antibody tests are most helpful when repeated after 1 to 3 weeks, looking for a significant increase in antibody levels. This means that while blood tests can help confirm a diagnosis, they are not as useful for immediate detection in the early days of illness. Because early treatment is crucial, doctors often start therapy based on clinical suspicion, especially if there is a known risk of exposure. Treatment of Murine typhus. The good news is that Murine typhus is highly treatable with antibiotics. The drug of choice is doxycycline, a member of the tetracycline family. This medication is given by mouth and is continued until the patient feels better and remains fever-free for at least 48 hours, but always for a minimum of 7 days. Doxycycline is not just effective, it also acts quickly, leading to significant improvement within just a few days of starting therapy. In the past, some parents and doctors worried about using tetracyclines in children due to the risk of tooth staining. However, recent research shows that short courses of doxycycline, lasting 5 to 10 days, are safe for children of all ages and do not cause tooth discoloration or enamel problems. It's important to take the full course of antibiotics, even if you start feeling better after a few days. Completing the treatment ensures that the infection is fully eradicated and reduces the risk of complications or relapse. In rare cases where patients cannot take doxycycline, such as those with severe allergies, alternative antibiotics may be considered, but doxycycline remains the gold standard for treating murine typhus. Prevention of murine typhus. While murine typhus is treatable, preventing it in the first place is always preferable. Unfortunately, there is no vaccine available to protect against this disease. Prevention centers on reducing exposure to infected fleas and the animals that carry them. Here are some key prevention strategies. Keep rodents and other potential hosts, such as opossums and stray cats, away from your home, workplace, and recreational areas. This can be done by removing brush, rock piles, junk, and stacks of firewood, all of which can serve as hiding places for animals. Store pet food securely and avoid leaving it outside, as this can attract rodents. If you must handle sick or dead animals, always wear gloves to protect yourself from accidental exposure. Keep your pets treated with flea prevention products, especially in areas where murine typhus is known to occur. Be vigilant for flea infestations in and around your home and address them promptly with safe pest control measures. In the United States, murine typhus is most commonly found in parts of Texas, California, and Hawaii, especially in suburban areas where people, pets, and wildlife intermingle. Staying informed about local outbreaks and taking extra precautions can help you and your family stay safe. Conclusion: murine typhus may be a lesser-known disease, but understanding its symptoms, how it's diagnosed, the importance of early treatment, and effective prevention steps can make all the difference. If you ever experience the sudden onset of fever, chills, headache, and a rash, especially after possible exposure to fleas or rodents, seek medical attention promptly. If you found this information helpful, don't forget to like this video, share it with your friends and family to help spread awareness, and subscribe to our channel. Make sure to turn on the notification bell so you won't miss any of our upcoming videos packed with valuable health insights. Stay safe, stay informed, and thank you for watching.